All right, welcome back to Velshi and Rule. Healthcare, particularly the Medicare for All proposal, is a key battle point in the Democratic presidential primary. Total healthcare costs under the plan advocated by Senator Bernie Sanders and others is estimated to cost $4.5 trillion over 10 years. Now, that sounds like a lot of money, but take a look at this. The estimate is about 22% higher than total costs under the current system over the same period. Remember, a lot of people don't get coverage right now. According to the CDC, this would provide, Medicare for All would provide coverage to about 28 million people who are currently insured. I'm not telling you that's the reason to support it. I'm just saying we're currently uninsured. I'm just saying math is always hard. Whenever anybody says, how are you going to pay for this, we have to explain what you're already paying for. Joining me from Capitol Hill is Senator Sanders. Senator Sanders, former Vice President Biden's plan builds on the current health care system, Obamacare, even though that's kind of been gutted by Republicans, but it would allow people to keep their employer insurance if they like it or buy into a public option. If the plan that the vice president is suggesting continues to include the essential health benefits that the Affordable Care implemented, why do you think that wouldn't be sufficient?
Well, first of all, I'll be getting back to the first point you made a moment ago. Virtually every study out there shows that Medicare for All will cover all of the people in our country at less cost than the current dysfunctional system, which at the end of 10 years will be spending something like $50 trillion. So healthcare is expensive. The reason that I oppose what Vice President Biden is talking about is that at the end of the day, we have got to do as a nation what every other major country on earth is doing: guarantee health care to every man, woman, and child as a right. The current system, let us be clear, is not to provide quality care to all. It is to make billions in profit for the insurance companies and the drug companies, and that is exactly what they are doing. Today, despite the fact that 80 million Americans have no health insurance or are underinsured, we are spending far, far more per capita on health care than the people of any other country. Today, we pay by far the highest prices in the world for prescription drugs. I'm going to be going from Detroit, Michigan to Ontario, Ontario, Canada, at the end of this month. We're going to be purchasing insulin in Ontario, Canada for 1/10 of the price we are paying in America, but the drug companies make tens of billions in profit. We need to change the system.
So you're never going to get an argument from me about healthcare looking more like the Canadian system. However, there's a complicating factor in the United States. According to the Kaiser Family Foundation, 49% of Americans have employer coverage. Gallup has found that 69% of all Americans rated their health coverage as good or excellent, which makes sense. I've got fantastic coverage. You've got fantastic coverage. It's expensive, but I do think it provides well. So talk to the people out there, my audience, who have good insurance. Why should they support the idea that that thing that they think is good is going to go away in favor of Medicare for All?
Because what Medicare for All does is provide comprehensive health care to every man, woman, and child in this country. If you've got good insurance now, Medicare for All is better. There will be no deductibles, no co-payments. Right now, millions of people don't go to the doctor when they should, even if they have insurance, because they can't afford the out-of-pocket expenses because of high deductibles. We are going to substantially lower prescription drugs. There'll be a ceiling on what people have to pay for prescription drugs. Right now, what people like is not their health insurance company. What they like, Ali, are their doctors, their nurses, and their hospitals. On the Medicare for All, we guarantee freedom of choice. You go to any doctor you want.
Every doctor accepts it because there's no choosing from doctors in terms of what program, what insurance they take.
Exactly. And right now, by the way, let's be clear. Many people cannot go to the doctor that they would like to go because that doctor may not be in their insurance network, and they have to pay a whole lot out of their own pocket to go to that doctor. So what we will do is provide comprehensive health care to everybody at lower cost than people are now paying.
So
I think it's
all
a good
these
idea.
other countries you and I talk about have instituted some version of universality a long time ago, generally speaking. While America didn't, we built up this system of pharmacy benefit managers and health insurance companies. We've created this entire thing, and there are a lot of people who say it'll cause a great deal of disruption to move over to a system like yours. Senator Kamala Harris is calling for a transition period, saying we can't change it overnight. Tell me what a transition looks like under your system.
Okay, well, first of all, Kamala is right, and she is on board my legislation. And that legislation calls for a 4-year transition period. So let me explain it. First year, right now, you got to be 65 or older to get into Medicare. And Medicare, by the way, as you know, Ali, is the most popular health insurance program in the country. What we do in the first year is do several things. We lower that eligibility age from 65 to 55. And by the way, we expand benefits for seniors by including dental care, hearing aids, and eyeglasses. Next year, we take it to 45, next year to 35, and in the 4th year, all Americans are covered by a comprehensive Medicare program.
Let me ask you about, and I want you to go slow here because some of my viewers are a little older, but the musician Cardi B, Grammy award-winning rapper Cardi B, is one of the 25 most influential people online, according to Time magazine. She has been a longtime supporter of yours. In 2006, she said, vote for Daddy Bernie. Just yesterday, she said she is really sad, she tweeted this out, about voters letting you down in 2016. What's your message for Cardi B and her followers?
Well, first of all, I thank her very much for her support. I spoke to her a few weeks ago. She is very sharp and understands a lot about politics and a lot about history, and I'm very appreciative to have her support.
Okay, I want to talk about some polling that's come out. We've got a Morning Consult poll and another poll that I think we got wrong earlier today. You're showing as coming in second place in a couple of these polls. This is the Morning Consult poll. Joe Biden's at 32. You're at 19. Elizabeth Warren at 14. Talk to me about polling and how you're feeling about it.
Look, I think, it's hard to poll nowadays because a lot of people don't answer the telephone. And this is, we're 6.5 months before the election. I think it's probably fair to say that Joe Biden, if the election primary were held today, would probably win. People know him, they like him. I think we have the grassroots support in this country. One of the points that has not been made as clearly as it should is that we have well over 1 million volunteers in this country. We have grassroots support, big time, in Iowa, New Hampshire, South Carolina, Nevada, and California. So I think at the end of the day, what primaries are about, what caucuses are about, are bringing out your people. And we have an excellent staff. We're investing in that staff. And I think on Election Day, we are going to win. And we're going to win because our agenda speaks to the needs of the working class of this country. Frankly, people are sick and tired of the wealthy becoming much richer, of corporate America making huge profits, and not just the insurance industry or the drug companies. It's the fossil fuel industry. It is all across the board. And people want a government that reflects the needs of ordinary people, not just the wealthy and the powerful. That's why we're going to win this thing.
Hey, MSNBC fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down there and click on any of the videos here to watch the latest interviews and highlights. You can get more MSNBC for free every day with our newsletters. Just visit msnbc.com/newsletters to sign up now.